Good evening. I'm Chris Ensing, the host of CBC Windsor News, our digital show that we've been offering here as the COVID-19 pandemic continues to create major changes across the world and here in our community as well. We begin today with the latest news. A positive COVID-19 case announced by the Windsor-Essex County Health Unit this morning. This was someone who was tested in Toronto, is self-isolating in Toronto, but someone who lives in Windsor-Essex. The medical officer of health saying this was somebody who routinely traveled back and forth, and they were announcing that this morning at today's briefing. That brings us to 5 people that the Windsor-Essex County Health Unit has announced as confirmed positive COVID-19 cases. Now, continuing with the theme of COVID-19, we're seeing something that the automakers are starting to do. Originally, the big 3, that's Ford, GM, and FCA, all announced that they were going to temporarily suspend production until the end of March, FCA saying into April. We can now give you an update that Ford has pushed back that start. They're now saying that they're pushing for beginning of April for some of the plants that are in Michigan. Locally here, the 1,600 employees that are expected to go back to work at our plants here in Windsor-Essex, they're expected on April 20th. That's 1,600 people involved there. FCA is saying they're hoping to restart on April 14th. Now, I spoke with the head of both unions, Local 200 and Local 444, about their concerns or what they thought about starting back up. And it was really interesting hearing from the head of the Local 200 talking about how there's a desire for people to go back to work because of so many who are on unemployment now or trying to find a way to feed their families, and the proud members of our community who work in the auto industry want to get back to the jobs they love so much. But the other part of this is making sure that they're safe. And we had a discussion about what he believes needs to happen. That's that deep clean that's been happening over the last week as they announced the temporary production halt. And there's also a push to make sure that there are more supplies like disinfectant and Lysol wipes, things to keep the people safe once they go back to work. It was a similar conversation with Dave Cassidy, the head of local union 444, saying that he wants to make sure that when employees are back, because of the tight quarters that some of them work in, that they're being in a safe environment. Now, these updates are available on our website, cbc.ca/Windsor, and that's the latest on the auto industry here in our community. Now, we're going to have a little later in the show an update on what the Sikh community is doing for the large number of international students in our area who find themselves in a difficult position. Some of them here far away from family, some of them just starting their semesters. I spoke with one person who recently graduated and talked about how difficult this has been for some of his friends and the people that he knows here, but also the students who have applied to St. Clair College and aren't sure when they'll be able to come here to start that new part of their life. Now, another big thing that we've been talking about here locally is the idea of those quarantine measures. And for that, we're joined by CBC's Katerina Georgieva here. I'm just going to come over and pull up our little setup. Again, everything looks a little bit different here. Hi, Kat. Thanks again for joining us. You are at home today on our bureau away from the bureau, I guess I could say. How are you doing?
I'm doing all right, working from home.
Working from home, working hard. Now, you've been looking at something that a lot of people have had their eyes on recently. We've heard of people upset that they're not coming, that some people aren't following those self-isolation rules, the quarantine that's available to them. But what can we expect as far as our protections under the civil liberties that we're allowed to follow as Canadians? What have you been able to find out about where that line sits?
Well, the big thing I really wanted to understand was what can our various levels of government do under a state of emergency? And as we've seen, these have been declared across the country. So to understand that better, I spoke with Brenda McPhail. She's a director with the Canadian Civil Liberties Association. And essentially she explained that these declarations give governments many more powers than they would have on a normal day. And we've seen various levels of this. So in Ontario, police can enforce things like non-essential businesses needing to be closed, groups larger than 50 are not allowed, things like that. In Quebec, under their Public Health Act there, we know that police actually arrested a woman who tested positive for COVID because she broke her quarantine by going out for a walk. So there's been an escalation over the past few weeks of the government saying, please do what we want you to do. you must do what we want you to do. And now, if you don't do the things that we want, there are potential penalties that you will face. And we saw this most recently yesterday when the federal government invoked the Quarantine Act. So now, if you come into Canada from another country, you're not just being asked to stay home for 14 days, you now have a legal obligation to do so. And there will be penalties if you don't do it. And the act gives the health minister the power to designate quarantine zones and fine or jail travelers who disobey. And we're also learning that travelers coming back to Canada will be subject to random checks as well to make sure that they're self-isolating. So again, all of these measures go beyond what a government can do on a normal day, but McPhail with the Liberties Association says it doesn't mean that they have free reign. There still needs to be public transparency and accountability in terms of what's happening, especially in a democracy.
And we see our elected officials talking about, when watching that evolution, please stay home, you have to stay home, you must stay home. And then there's that idea of what might be coming. What could that mean? What could come next?
Right. Well, there's what could come next, and there's also been sort of hinting at where we are even now, because last weekend the federal minister of health said civil liberties could be put at risk if people don't follow recommendations around self-isolation, and that was before the Quarantine Act was enacted. And then on Monday, Trudeau said nothing was off the table. And this week there was another conversation that came to light around the possibility of the use of cell phone location data. So this is something already happening in other countries like Italy and Germany to figure out where people are not following social distancing rules. In China and South Korea, that's gone even further. There they're using data to track those who have actually tested positive to make sure that they're quarantining. And Trudeau was asked about it this week, and he said it's not something that the government is looking at right now, but he reiterated all options are on the table to do what's necessary to keep Canadians safe during, quote, exceptional times. So essentially leaving the door open to this. And the mayor of Toronto even mused about possibly using cell phone data as well. But the city of Toronto has since said it is not and it will not be collecting cell phone location data. Now, I did reach out to the Windsor mayor's office to see if this is something under consideration locally. I did not get a direct answer, but I did get a statement from his chief of staff saying, in part, as the federal and provincial government continue to implement strict orders and recommendations, we will continue to monitor the impact on our community. And I should say that this public conversation around the possibility of data use was also a red flag for Kristen Thomason. She's a law professor at the university and she's a privacy expert. She says if any level of government chooses to go ahead with this, it raises a lot of questions, but that they would need to think hard about being very transparent about what restraints would be in place and to really assess if this is something we'd even want to see in our society.
It's so interesting to hear you talk about transparency because before COVID-19, there was a lot of discussions about people's privacy, what people were allowed to do, what people had to do. How do we balance all of this to protect our health, but also civil liberties at the same time?
Well, it's really tricky, especially if some people are not following the rules that are there for their safety, and so they're endangering others as a result. So ultimately, Brendan McPhail says it's a balancing act. So all of these conversations need to be transparent and public. So those are two things that she says she's looking out for. And the government needs to consider what's being done in the name of public good while also protecting our rights and freedoms, especially in a time of fear. And we have to remember that we have to live with the decisions made now after this has all passed. So far, she says that our governments have been moving very carefully. They've been drawing on science, providing rationalizations and justifications as decisions are being made. So that's very positive for her to see. And I just want to leave you with a quote from her here as we wrap up. She said, "It would be a tragedy if what we lose in this pandemic is not just the health of our economy and the health of our population, but also the health of our democracy." So she says her group is going to keep a close eye on things to make sure that that doesn't happen.
It's an interesting perspective. Thanks for this, Kat. I really appreciate it.
Thanks, Chris.
All right, I'm going to hang up on our coworker there. I apologize, Kat. Nothing personal, just the way things are going here. And I'm going to pop back over here. So as you hear there, that call again about civil liberties, about what we're able to do, how we protect ourselves, and how we can protect each other. I know that we heard from Mayor Drew Dilkins about Malden Park as being one of those places where people are being encouraged to get out, but there's still that idea that just because you're outside doesn't mean you should be making large groups and hanging out with each other closely. Again, the fear there being that spread of COVID-19. We can say again, for those just joining us, that there are 5 confirmed cases according to the Windsor-Essex County Health Unit in our region. And I want to point to a story that we have up on our website here now, and it talks to people on the front line. So an emergency doctor in Michigan and here at Windsor Regional Hospital. Dr. Paul Bradford says that they are currently preparing for the possibility of cases in our region skyrocketing. Now, when we talk about skyrocketing, we're wondering how large those numbers could get. According to Windsor Regional Hospital, there are 50 people who are possibly COVID-19 positive. So when we talk about the amount of tests that are happening and how long that delay is, there are 50 people that they're treating with symptoms and keeping a watch on. Now, they don't have any more details to say whether or not they are positive. Again, we only have 5 confirmed cases, but they do say they have 50 people who they are treating who are awaiting test results, and that's here at Windsor Regional Hospital. There's more than those 50, but those are the 50 that they pointed to say that they have a close eye on what's going on there. Another thing that we're watching very closely as well is what's happening in Sarnia-Lambton. You'll recall earlier this week there were 5 cases of positive COVID-19 tests, and those were for people who were all 60 or over, ranging in age from 60 to their 80s. And we're getting more details about how they're doing. Later on, we'll play a little bit of an interview from a doctor in the Lambton area who has some concerns about what's going on there. As we talk about what's happening and what's changing, we take a look at what's happening in the city of Windsor. And for that, I'm going to bring in our Tamina Aziz here. Tamina, I'm just going to get you to put your hand out just like this, just to make sure that people recognize we're doing the physical distancing on our side as well. And you're looking into some of the ways that the city is responding to all of this. What have you found out today?
Yeah, that's right, Chris. So bus services are going to be temporarily suspended until the end of the day on Sunday, and it will remain suspended until at least Monday, April 13th. So for about 2 weeks, people won't be able to use transit in the city. Mayor Drew Dilkins says this is in response to COVID-19. He says this, and according to a news release sent out this afternoon, it reads in part, "This action represents a precautionary measure to help safeguard the health and well-being of transit riders and operators alike to further help lower the risk of community infection within the city of Windsor. I recognize that despite the health warnings and advice, many in our community still rely on Transit Windsor for their daily needs. But the risks associated with COVID-19 outweigh the inconvenience this shutdown will cause. We should note that bus services will continue through the weekend, so people will still be able to shop around and use the buses until then. But I should also note that playgrounds, play structures will also be temporarily closed down in the city. This includes swings, slides, playgrounds where children play. This is as a result of, or rather to reduce opportunities for gatherings and close contact. This comes after other cities and towns have done the same. This includes Tecumseh, Lakeshore, Amherstburg, and the town of Essex. An infectious disease specialist at the University of Toronto spoke with CBC News, and he says that playgrounds are not appropriate during this time. Regardless of how empty things may be right now, you don't know how many people have touched those surfaces, so it's best just to stay away. But you know, parks, trails, and open spaces will still remain open. Dilkins says that these spaces still offer people the opportunity to practice social distancing, which again is what we're continuing to do here today. Chris.
Absolutely. Glad to hear this, Tamina. I appreciate you taking the time here. Another look at what we've been dealing with here locally is the border as well. When we look at what has happened with the restrictions, we see that call again and again for people to limit essential travel going from Windsor into Michigan. But a pretty major story that broke today, Global News first reporting it, CBC was later able to confirm, the White House, Donald Trump's organization, his administration, looking at bringing U.S. troops to the shared border. Now, this is something that Canada strongly opposes, according to Deputy Prime Minister Chrystia Freeland. She said today this is an entirely unnecessary step. which we would view as damaging to our relationship. This got a lot of attention during the briefings that are held today in the afternoon. A source with knowledge of those discussions at the White House told us that they're looking at placing 1,000 troops about 25 kilometers from the 8,891 kilometer long border, and they're going to use remote sensors to look out for irregular border crossers. It's not happening yet. The source stressed that the U.S. hasn't made a final decision. Another source who spoke on condition of not naming themselves because they were not able to speak about these measures on the record said that if the plan moves ahead, the deployed U.S. Department of Defense personnel wouldn't have any law enforcement powers, so they'd be tasked with watching the ports of entry. According to them, the main concern here is that people might be crossing into the United States from Canada that are COVID-19 positive. Now, that's a story that we're following closely here because it's something that is out of our time. We would have never been able to point to a recent moment when we've seen that kind of a military response along our border that we share with the United States here. Quickly here now, just before we talk over to the Sikh community and to hear about how they're helping people within our community. Some news non-COVID related, and it's a historic charge that was laid by the Windsor Police Service. A 32-year-old Windsor woman has been charged with manslaughter after someone died of an overdose. Now, the death happened a month ago. Police responded and found a man who was dead at a home. Investigators determined that it was a fentanyl overdose. Now, following interviews, reviewing security footage, and going through search warrants, police found a suspect in the case, and they charged them with manslaughter because they believe they provided the fatal drug to the person who overdosed. Now, that woman's been charged with manslaughter, 32 years old. They're also charged with trafficking a controlled substance and failure to comply with a release order. Again, that's something that the Windsor Police Service says that they have not done before. And while we do want to pay attention to everything that's happened COVID-related, it's important to note that that is what's going on in our community at the same time as we try and battle this pandemic. I'm just looking at some of the comments here on the Facebook feed here quickly. What about having the big three start back up? Great question. We do have some news on that again today. Ford pushing it back, hoping to now start operating in April, the first week for some places in Michigan, April 20th for the locations here. FCA is looking at April 14th. And I do not have an update from General Motors. When we went to air, they had not released anything publicly. Now, I'm just going to walk over here where we have our guest up on Skype. I'm just going to pop over here. I'm sorry for this. Just while I pull you up here, I'm just going to get you to introduce yourself, if you could. Just let people know who we're chatting with.
Hey, my name is Manchetan Sivia, and I belong to the Sikh community of Windsor.
We're calling you today because there's been an interesting development here at St. Clair College. We've noticed that they've gone to online classes. They've shifted the way that they're operating now and changed the spring intake as well. And as all of this is happening, my mind went to the international students who are here. My family, my mom and dad are in London, Ontario. I'm not going there, but there's no physical distance between us. But we know the international students who are here, it might be difficult for them with their family and friends back home. What have you been hearing so far when you talk to some of the students or some of the members in the community?
Well, the most of the problems that the people are having with the international student community is the students who came in the January semester. They don't have the knowledge of the city. They haven't get used to the living abroad, away from family. Those guys are having the most trouble finding food. With the COVID, the COVID-19 going on, the most problem they have is being scared.
Yeah.
They don't want to travel. So, yeah, we are trying to help them out.
And I can understand you got something on the go in the back there, but when you look at being able to help people out, we've seen this from some places. We've heard about the food bank having more need, more desire for donations, and more people asking for help. What are you offering, or what are the international students being able to make use of within the Sikh community?
We just want to make it clear. It's not for the international students only. We are trying to help everyone out.
How does it feel to be able to do that during a time when so many people are looking for that extra hand?
We are just continuing our old custom of Sikh religion of helping people out. Langar, which means community kitchen.
What have you seen so far as the uptick? Have you noticed that people are reaching out and asking for help?
Yes, they are. People don't like to travel anymore. What I hear right now, the city is suspending the bus service next week.
Yeah.
So I think we need to do a little bit more than we are doing now, but we'll be able to help everyone out.
It's always so inspiring to hear how people are able to lean on each other when stuff like this happens. If someone wants to help you help people out, what's the best way of going about that?
What we are doing right now is we are supplying food, packed food, like pulses, beans, bread, stuff like that. We are not making any food. We are not cooking. So if anybody wants to help, right now we are trying to keep the hands minimum.
Yeah.
Yeah, so best way to help out is you can give us a call and let's see what we can do.
No, it's always interesting seeing the way that our community reacts. As far as what you've seen, has there been a moment when all this is going on that you've seen as sort of a highlight, a bright spot, or an encouraging moment for you when you think of how Windsor's reacted to what's going on?
Well, right now, what I see on the roads, we are still in high spirits.
Yeah.
Yep.
No, that's beautiful to hear. I appreciate you taking the time to chat with us today, and we'll for sure let people know how they might be able to help out. And I appreciate what you're doing for our community and how you've been able to look after people at a time when they may need it the most. Thanks again, eh?
Thank you.
I appreciate it. All right, I'm going to hang up here. Nothing personal, but the way that we have this technology going. So as you can hear, there's again that desire for people to look after each other. And that comes at a time when we're sort of in a mode where our food banks, according to Jacob Parker's story that he had done earlier, are not getting the donations that they once did. And we've also seen this at the Windsor Islamic Association. We have a story on our website. Amy Dodge put that together on cbc.ca/Windsor, and it talks about how there's this push to help feed seniors. And we think of the people who are most vulnerable during the situation. There's about 30 volunteers who are helping the association get in touch with people who need help, donating the food, but also there's an ability for them to go and do grocery shopping as well, if that's something that would be helpful for them. And it's also something that we're seeing en masse when we talk about the masks that people are making for each other. So there are those bright spots inside of our community, but this is also a time when we're hearing some dire warnings. And what I'm going to do now is I'm going to play a video for you from a doctor in Sarnia-Lambton area. Now that again is where we've seen the number of cases going up. We saw 5 that were announced recently. And what I want to do is just play part of what he's been able to post on YouTube here so you can get a better sense of what they're dealing with and how dire this situation might be for our friends who live in the Sarnia-Lambton area here.
And I just wanted to send out a plea to our community, our patients and their families about the evolving situation. Today is Wednesday, March 25th, and it's the evening. And as you may have heard by now, Public Health has announced that indeed Lambton County has 5 confirmed cases of COVID-19. It is my understanding that all 5 of these patients are hospitalized. 2 of them are in the ICU, one of which was in Petrolia. What the public may not appreciate is that there are pending cases, some of which are considered to be positive. So it's out there, it's in Lambton County, and we are anticipating that more people have been exposed and more people are going to be sick. So here's my contributions and my suggestions to myself and to the community at large. First of all, don't panic. We have an incredible healthcare system with physicians who absolutely care and are working around the clock. A public health network that is literally updating its recommendations by the hour. While our system is stressed and while our resources are limited, we are trying our very hardest. And so we implore the community, to those who have thanked us for everything, it is very much appreciated, but our work is not done yet. And we ask everyone to follow the guidance and the suggestions of our healthcare authorities because they have our best interest in mind. Now, having said all that, because of today's news and because of the trends, we are now evolving into a very serious situation. And while this is true across the country, it is now coming true to Lambton County. So, a reminder to myself and to my patients and to everybody who comes to the Central Lambton Family Health Team or has received care at Blue Water Health, please, on behalf of my colleagues, on behalf of all the frontline healthcare workers, please self-isolate. I can't stress that enough. If you are a traveler who just got back from traveling during the March break, if you are displaying mild symptoms, if you are a family member of one of the patients who is in the hospital, or you believe you may have contact with somebody who shows symptoms, please, now is your time to play your role. Now you can help us the most by self-isolating. Anybody with mild symptoms, we are strongly urging that you self-isolate at home for 2 weeks. This does not mean congregating with extended family. This does not mean going to shopping or picking up groceries or whatever. Have somebody do that for you. During these times of crisis, we are reminded by the good that is brought out in people, and there are so many volunteers in the community who are willing to help. Use those. But if you are showing mild symptoms, you must stay at home. And for those who are not showing symptoms, who are non-travelers, understand that this is now community spread. There is strong suspicion that the patients who are having these symptoms have no travel history. And so we want you to do your part also and to quarantine. So this message goes out for everybody. Whether you've been exposed, whether you have traveled, whether you have family members, stay home. I can't stress that enough because the next 2 weeks are going to be critical. We could be on the same trajectory as some of the other crisis spots around the world. We can mitigate the damage, we can flatten the curve if we do our part by, once again, staying home. Blue Water Health is...
I'm just going to stop that there. Again, a message from a doctor in Central Lambton, but a good message for us across Windsor, Essex, across Southwestern Ontario, really across the world. As you hear there, that desire to flatten the curve, as we've heard, that desire to make sure that we're not spreading the coronavirus, and all of this, as our medical officer of health said this morning here in Windsor, Essex, that the risk is increasing and that the idea of community transmission is just a matter of time. Now, we have more on these stories and others on our website at cbc.ca/Windsor. Our morning team is always giving you the latest information that we have in the morning on Windsor Morning. That's with Tony Doucette. And we also have CBC's Afternoon Drive that is on in the afternoon. You can find us on social media as well. You can watch these on Facebook. You can watch it on our website, cbc.ca/Windsor. And you can also find us on Twitter and Instagram. Just search CBC Windsor on both of those. Thanks for watching. Stay safe.